Thank you, Alaska Karen. I'm supporting the government's motion tonight. We're determined to reform the health service. We know that this poses a challenge for the government, but we will meet this challenge. The reform will take us some time, though. The opposition motion in front of us is saying that our plan for reform will fail, even though we haven't had a chance yet to finish it. Well, they know about failure, certainly they do. Their plans failed. In their time in office, they managed to double the expenditure in the health service, but they still left us with an underperforming health service. I think one thing we need to do is we need to learn from your mistakes, and we need to make sure that we don't repeat your mistakes, because they've been very costly to the Irish taxpayer. The HSE does need to be restructured. We started to do this with the new board and with the upcoming health service legislation. One other reform that we're looking at is a reform of the health service itself. That started. The move towards universal health insurance began with this year's budget. This means that free GP care to long-term illness claimants will start this year. From 2013, we plan to extend free GP care to patients who receive medicines under the high-tech drug scheme. And then we'll open up access to subsidised GP care for all. Our plans are ambitious, there's no doubt about that, but they are achievable through a better use of resources. The motion tonight also raises the question of the North East Service Plan for counties such as my own county of Meath. And while we're faced with having to reduce the budget, and we recognise that, it has to be also recognised that we're still investing in services. For example, there's €5 million for primary care service staff. This is going to go towards staff in primary care centres, such as the centre that's being opened up in Ashbourne in the autumn. And this centre will provide a comprehensive service to the residents of the area. It's good news for the residents of Ashbourne, but it's also good news for nearby hospitals, as illnesses are caught earlier and treated quicker. The rollout of primary care centres at Ashbourne and in other places around the country is key to our overall health strategy. Alas, Count Corla, the result will be a more effective spend for the taxpayer and one that gives better outcomes for patients.